Postpartum body changes and exercises. What is postpartum body change? It is the postpartum period that begins immediately after giving birth. This period lasts for 6 weeks. Importance of health teaching. It is important for the mother to understand the physical changes her body will go through following the birth. Postpartum care will address any adverse effects on the body. Postpartum body changes in the mother. All these changes that occur happen within the integumentary system, reproductive, cardiovascular, urinary, musculoskeletal, gastrointestinal, and the immune systems. Types of things to monitor in the reproductive system: the uterus, cervix, vagina, perineum, and breasts. Cardiovascular, cardiac output, blood volume, coagulation, blood values, chills, and orthostatic hypertension. Urinary system, kidney function and bladder, gastrointestinal, constipation, integumentary, hyperpigmentation of the skin, musculoskeletal, abdomen, and immune system infection. Within the reproductive system, it is important to monitor the uterus, as the uterus undergoes a rapid size reduction after birth. The uterine lining is important as well, as the lining will shed as the placenta detaches. The loca, the vaginal discharge after delivery, gradually changes after birth. Within the reproductive system continued, the cervix, some swelling will occur within the first few weeks. Vagina undergoes a lot of stretching during pregnancy. Perineum, the perineum often will be tendered and bruised, and the breasts will change. The first 2 to 3 days, the breast will be full but soft, and breast engorgement may occur where the breast is hard and very uncomfortable. Types of things to monitor within the cardiovascular system: cardiac output and blood volumes. Women will experience an average of 500 milliliters of blood loss from vaginal and 1,000 milliliter blood loss from C-section. Orthostatic hypertension, a woman's blood pressure will drop when she sits or stands, may feel dizzy or lightheaded. Blood values, white blood cell count will rise to a level that would be suspected as an infection. It is actually response to inflammation, pain, and stress. It should return back to normal within 12 days postpartum. And chills, many women will experience tremors after birth. These chills should stop about 20 minutes prior to birth. Gastrointestinal, gastro system will remain normally active shortly after childbirth when the progesterone decreases. Constipation may occur during the postpartum period. Within the urinary system, immediately after birth, sets to rid the body of excess fluid that has accumulated during pregnancy. Integumentary hyperpigmentation will disappear as the hormone levels decrease. Stretch marks will go away, but they will fade to a reddish purple, or from a reddish purple to a silver. The abdomen wall will become gradually stretched. Some women may be shocked to see they still look pregnant prior to giving birth. They should be reassured that with time and exercise they can tighten these muscles. Abdominal wall weakness may remain for 6 to 8 weeks. Immune system watching for infection is one of the most necessary components following the childbirth. Pain management following childbirth. Women need to be assessed for pain after birth. Some, if not all, will require some special pain relief, such as opioids and non-opioids. Heat, such as heating pads, may help with uterine discomfort. Ice packs, also used for uterine discomfort and perineum in the as well as the perineal area. When can these women begin exercising following the childbirth? They can begin light exercise about as soon as after childbirth, although women who have undergone a C-section should wait a little longer. Low-impact exercises such as walking is the best form of exercises. What are some easy exercises you can complete after childbirth? Abdominal tightening, head lift, pelvic tilt, Kegel, breathing, and walking. Health teaching. Vaginal discharge after the birth consists of endometrial tissue, blood, and lymph. Normal loca is fleshing or menstrual odor. Abstain from sexual intercourse or activity until the local flow has ceased. Expect stages in progression of the loca and advise the patient to report excessive bleeding, large blood clots, or constant trickle of the loca to their physician. Interventions to support health, wellness, and healing. The fundus nursing interventions will be assessed routinely for firmness, location, and position. Things to watch for: foul smell, fever, unusual or heavy flow, and bright red in color. For the perineum, this should be assessed routinely after childbirth, should be watched for normal healing and possible signs of complications. Using an ice pack applied to the area for the first 24 hours to reduce swelling, 20 minutes on, 20 minutes off. Sitz baths will cleanse the area and promote healing. Peri-care after voiding or having a bowel movement, and squeezing the buttocks together when sitting can reduce pain. The loca. Monitor the smell. A foul-smelling loca is the sign of infection and needs medical attention. Assess the fundus to ensure it is firm and midline. Massage a poorly contracted or boggy uterus until it is firm to prevent hemorrhaging. Do not push down hard or invert if the inversion of the uterus can occur. Encourage the mother to empty her bladder to ease the uterus' ability to contract. Nursing interventions for the urinary system. Kidney function will return to normal a month following birth. Some health teaching and nursing interventions are regularly assess the bladder for distension, provide privacy for the mother, run the water in the sink, use a peri bottle to squirt water over the perineal area, and relax the uterine sphincter. If high fever or chills are experienced, this may indicate kidney infection. Bowels. Assess the bowels as it is important in all postpartum patients, especially C-section patients. It is essential to maintain normal patterns and avoid constipation. Assess the bowels for sounds and passage of flatulence is very important. And that is the end of our presentation. Thank you.